Hello, and welcome back to the Talk No One Talks About, where I bring you every unpopular topic, every rarely discussed issue out there, one episode at a time. And as I always tell you, I will not be doing this alone. I will always have here with me people with lived-in experiences and or professionals. So today, I have two very amazing professionals here with me. Please let's meet you.
My name is Grace Isongakwan. I'm an SRH expert, and I do work a lot around technology too as well.
Oh yeah, you do.
My pronouns are she, they. It's nice to be here.
That's nice to have you. I want to talk like you when I grow up. Okay, let's meet you.
Hi, I'm Malin Oluchi. I work in the policy and advocacy space around the intersections of gender justice and LGBTQI plus rights.
Oh,
Yeah.
awesome. A lot of
She, they pronoun, yeah.
welcome. It's so awesome to have you here.
Thank
Very,
you.
very technical people. We're about to hear big grammar.
Not that serious.
We're about to hear big grammars. So I would advise you take a sheet of paper and a pen and follow me. I have my phone. I'm taking notes. I'm here to learn, as we all should. Of course, that's the purpose of conversations like this. So to start with, I want to ask a very technical question, right? Technology has facilitated so many justice and access to issues for marginalized communities and people into this world. When you look at SRHR, when you look at the SRHR landscape in Nigeria, how has technology impacted the access of LBTI plus people?
Do you want to go first?
Okay, I can.
Yeah.
We're talking about LBQ women, we're talking about gender non-conforming persons, trans women and men, and non-binary persons around those intersections. And primarily, these are communities that are, first of all, already gender marginalized in a place like Nigeria. For those who are women, queer women, you're already gender marginalized as a woman. So you're already existing in a very shrinking sexual and reproductive health and rights space to start with. Then being queer means you have different needs. Right? If you're a trans woman, if you're a trans man, if you're a lesbian, if you're bisexual, if you're intersex, you have very different SRHR needs from what the average cis Nigerian person wants or needs, right? So, and we don't even have provisions to start with. So it's a very restrictive, inaccessible, both service, education, and medical, very medicalized space to policy. Like you're literally existing in this space where you don't have access. But generally, in the past, let me say the past couple of years, I don't want to go as far as saying a decade or thereabouts, with technology, tech advancements, digital spaces has ensured that there is a lot more access than we used to have. Even if it's things as basic as information, right? Like people could literally sit at home now and come online and access information on why their bodies are changing and what kind of changes they're experiencing, how they feel about their sexual needs, what their rights are even like. So there is a lot more access to information, but I don't think that has impacted access to resources as much, right? So there is more information than we used to have for SRHR of LBQ, LBTI communities generally, but there is lack of access to necessary resources, necessary services, healthcare. That is still like way back there. We have not scratched the surface.
Thank you so much. That is so.
I like the angle Malin came with, and if you want to look at it in terms of healthcare, we've also seen that there's been some sort of increased access regarding mental health, and we see a lot of LGBTI persons are beginning to have access to that. This was something that even an average Nigerian was not even able to have access to. But now we see that technology and the constant need to actually talk about these things have brought technology and mental health in a way.
To us.
Yes, to each other. So if you also look at the conversations even happening within the context of Nigeria, we're beginning to see that telehealth is becoming a conversation within the space where, okay, how can I access information around medically? And then you can see that people are beginning to think through how to create telehealth applications, mobile applications for LGBTQI persons who would naturally would not want to go to a hospital to access healthcare because, the mere looking at me, you could discriminate me, or the mere looking at me, or you could make me feel unworthy of even being or trying to even access healthcare to start with. So we see that technology has started having that conversation around telehealth, and that's good. We see technology having access, having conversations or bringing up, how will I put it? Bringing up, I won't call it artificial intelligence, or more like merging technology and mental health together. So that's something that's happening around LGBTI space too as well. I would also say technology has brought in a lot of conversation within the media. So information that have been lacking within this space, having to even understand who a lesbian is, or who is a bisexual, or who is a trans person. The media has, even if it comes out in the bad light, but there is that visibility utilizing technology. We see that happening within social medias that we have in Nigeria, and people are beginning to get visible about, there are certain persons like this in this country. There are certain persons who behave like this in this country. And that is because of technology and social media.
Thank you so much. I knew this would be very enlightening. I should have come here with a pen and a paper. I really should have. So when we talk about these technological advancements, or these new methods and solutions that are coming in, right? What would you say are sustainable, right? Because a lot of it seems very temporary. It seems very what's it called? SOS-ish, like, this thing is happening right now, let's treat it. But like, what are the measures, right? Or what are the measures you think that are already going on right now that will provide more sustainable solutions?
Okay. I think, first of all, one thing I've really noticed, SRHR landscape has been so medicized that we just think about, abortion rights. And that is why when we approach it from that way, it's easy for conversations to be shut down. You people want access to, is it HIV testing? That is what people think about. Is it access to abortion? We're so far from it in Nigeria. Like, we don't talk a lot around bodily autonomy. We're so far away that people are not talking about reproductive coercion, which is like a very big problem. It's one of the major kind of IPV, intimate partner violence, which is a form of GBV that is very prevalent in our space, especially for our communities, LGBTI communities, because we have people existing in societies where the policies that exist, why you cannot go to a hospital as a trans woman and get access to the kind of healthcare you need, power dynamics, what they even understand about sexualities, about gender identities. So I feel like we're doing a lot of work as a community, as organizations, around looking at the medical aspect, provision of services, access to services, which is very important, but we're neglecting where we should have started from using technology to bridge that information sensitization gap. It's as easy as having a CSE curriculum, or even like an app for kids, where you are not necessarily even talking about queer people because of the Nigeria context, but where you have exercises where kids can just have exercises where they ask questions about their African identity, decolonize what being African is, what kind of people exist in your culture, how do they present, how do they dress, even things as simple as dressing will come out with men wearing skirts and gowns. that is how we start decentralizing what our identities look like, even as Africans.
Yes.
That is where we start talking about what we look like, what
Yeah.
we feel
Before
like,
colonization.
what kind of needs do we have.
Yes.
And it's easier to come in with conversations around SRHR needs, because we keep forgetting it's not just reproductive health care. We're talking about rights. We're talking about understanding of even what sexualities mean. That is not all about sex. That is about identities. That is about power dynamics and politics. So it's like, there is this, what we're doing cannot be sustainable if we don't leverage tech and things as basic. It can be something this basic for children, even for adults. Initiatives, strategies that look at desensitizing how people think about their own identities. Now, this example, for example, is coming from a perspective where we're not even exactly talking about queer identities, but the queerness of our identities and our culture, it's prominent. So it's like, how are we even approaching SRHR using tech? There is a lot of opportunities that would attack the issues of inaccess we have from narrative change. If we have people who understand, who are desensitized from the kind of discrimination and stigma that prevails, then we have better opportunities to have people who would be in places to say, oh, we actually need this kind of medical care, or we need this kind of SRHR intervention, or there is this kind of sexual and gender-based violence against LGBTI persons. So it's like a process. I feel like we just skip to the medicalization of everything and leave behind the bulk of the work that tech can enable us do, which is a lot of sensitization and narrative change.
Wow. Wow.
The way she said the wow.
Picture this.
Practicals.
Look at, I think, because I always like to go into the technicality of things.
We love it.
So if a trans person, a person who identifies
That's
as
what we are picturing.
Yes, we're picturing, picture that. A person who identifies as a trans woman, but physically does not look like a trans woman. You know, there's this difference when, a trans woman actually has the physical attributes, but no, picture a trans woman who does not have the physical attributes of a woman, but they identify as a woman. And they walk up to healthcare centers that have not been reorientated about sexual diversities, sexual orientation, gender identities, and all of that. They will not feel comfortable taking medications that affect their health just because of that discrimination.
Yeah.
Imagine technology. So imagine technology bridging that.
Yes.
Just looking at Jumia or Konga, that you just order things online and then it comes to your house. Nobody even knows who that item belongs to.
Yeah.
If a trans woman can do that with technology, I feel that their healthcare would improve. I feel like their health will improve. Picture that for a trans man. Picture that for an intersex person. Picture that for a non-binary person. That is how technology can improve lives of people that even within our context, Nigeria here, where we're not, how will I put it? The government does not approve of our identities or even our lives to start with. That could do a lot in bridging healthcare access. Imagine having to have, I think that is already happening within the mental health space, where you can have conversations with mental health therapists online. Imagine having to have constant access whenever you feel down. Technology helps you bridge that gap to talking to someone who is literally in another state. You don't have to leave your comforts or your houses just to have access to that kind of service. Imagine having to have prescriptions using telehealth with a doctor and sending it down using telehealth to get your medication to you. These are the little things that technology actually bridges when it comes to healthcare. But people do not see it that way. People see it as, I don't know how to put it. I don't want to sound, I don't know how to put it, but I don't want to sound misogynist. But at the same time, people take technology to just be only about web designing or web development or having to just build. No, it's not. It's as much as having that little information on where can I get paracetamol in a safe space for my identity. It's as simple as that.
Yeah.
That's how we should see technology. If we're able to look at it in that aspect, a lot of things will fall into places. A lot of things.
Yes.
Look at what is happening with TikTok. Now, there are a lot of conversations around sexuality. There's a lot of in fact, visibility of LGBTI people started since January this year, and it has constantly been on social media. What if alternative radio systems, alternative radio programs constantly talk about these issues? There will be a lot of narrative changes with technology.
Yeah.
So we need to see it in that aspect to be able to know that we can, as human beings, see that technology can be used in ways to improve the lives of everybody. Does it even have to be an LGBTI person?
Yeah.
So that's what I want to say.
And just to add to that, like, who are the creators of tech? Who are the people providing and creating, doing research? Who is doing research around these issues, around SRHR access? Who are holding that conversation? This is one. It's going to be on the internet. Who is talking about what? How knowledgeable are they? Are they part of the community? That means also, as a community, we need to stop looking at tech capacitation. We need to stop looking at using tech. The digital space is here. Technology is here to stay. It's not going anywhere. We're in, I think, the 4th industrial revolution, which means you can literally even brush your teeth with the enablement of tech. We can't do without it.
AI for teeth brushers.
Exactly. So it's like we are not looking at queer people who need we need people who have access to technology, because we are so digitally marginalized that we have so many people that don't even have access to ordinary telephones. Right? We're so disenfranchised economically that there are so many queer persons that cannot even afford data because they can't even sustain jobs. They can't get access to jobs to sustain those jobs because of how they are presenting or their identities or sexualities. So you see how intertwined it is. So it's not enough to just do tech programs where we gather people and like, oh, come and learn how to do tech training, come and learn how to be an executive assistant online or virtual assistant or build websites like Grace said. Like it's a lot more than that. After learning, first of all, where do they get the data to join the class? If it's physical, after learning, how do they apply it? With what devices? Who are the people creating tech solutions? Because we look at the small parts and we forget that there are other big parts. Who is doing research around healthcare access, SRHR access? Who are the people making decisions in our hospitals? Who are the people making the policies for what SRHR means or what is even available, what kind of services you can get in a hospital or healthcare unit? Who are the people creating AI? All these tech solutions, if we want to create if we want to create something as simple as where people can anonymously come online and get HIV test kits without needing to leave their house because of maybe stigma in the community. Who is creating that tech solution?
Those solutions
right?
are not there.
If a hetero person is creating that, who does not even understand what queer realities are, who does not even know the different identities, gender identities as basic as that exists, there is no how they'll be able to create sensitive, safe tech solutions for us, because then we're looking at privacy. We're looking at people that need this access because they need safety to be able to access this. So, I'm coming from the angle of looking at who are tech creators, where are LBTI plus people persons there, where are our queer women, where are our gender non-conforming persons, who are the people in internet governance, where are our people? We should be capacitated beyond just doing website design. There is so much.
So much
creators. We need to be there. That is how we have sustainable solutions. Because if we're not a part of it, these solutions will keep coming. They will keep bettering the life of the people it's modeled to attend to, and we would still be having access problems that we keep having.
Wow. Like, I knew that this would be entertaining. Sorry. I don't think entertaining is a word. I knew that this would be enlightening, but like, I feel like I did not I do not estimate this level of knowledge. Thank you so much.
Yeah.
Thank you. So I have to ask, right, very briefly, please, because this has been exciting, but we're almost running out of time. I have to ask, what you think or what you would say that organizations are doing, right? Organizations that cater to these minorities people, because like it or not, they exist and they exist even here, right? What would you say organizations like these are doing that you consider commendable, right? Either whether it's sustainable, whether it's even temporary, because sustainable or not, help is help, even if it's temporary, right? We have to first take the temporary help before we can think of the help that lasts like generations and stops whatever issues that will arise, right? So whether it's temporary solution or whether it's like really sustainable solutions that can last for decades and help like a vast majority of people in these minority communities, right? What would you say the presently existing organizations and communities that cater to LBTI people, right? What would you say they are doing? What would you say is going on right now that you think you can go to bed and think, oh, this is commendable work. At least this is happening.
Do you want to go?
Okay. You're always deferring to me. Okay. I think first of all, for the first time, we have organizations that have even things like databases where queer people can access. If let's say you live in Makurdi, for example, you can reach out to organizations that would give you the names of at least safe healthcare facilities where you can go and access healthcare that you need as a queer person, as a member of the LGBTQ plus community. We have organizations that are also, because also there was this whole big problem also where LBTI, especially LBQ women, were completely left behind when it came to SRHR interventions. Mainstream organizations were doing a lot around women, right? Cis women, their access to SRHR. And then there was a lot, because of the HIV wave, then there was a lot around, gay men, yes, SRHR. Yes. But it got so bad that at some point, nobody was talking about how lesbians are dealing with their sexual and reproductive health. Yes. Nobody was talking about how intersex persons are dealing with it. Nobody was talking about how bisexual women were dealing with it. Yes. So there was this huge gap. But like in the past couple of years, it's quite commendable that organizations are coming up and talking about this. There are a lot of conversations going around bridging the health gap, and not just with us as queer organizations, but even mainstream is translating into that space too. Yeah. We're seeing funding saying, SRHR funding, even like Global Fund, for example, and they're like, no, we need inclusion. We need to see minoritized communities that has been left behind. That is commendable, that we are realizing that we have been making these mistakes and we are correcting them. We're seeing research coming up, even in Nigeria, there's this big research gap. And it's commendable, even though I don't want to commend it too much because there's still so much that needs to be done. From funding to actual programming, right? Yeah. But it's really cool that now we have things as basic as databases where people can access self-health care. At least it's not enough, but it's the start. We have mental health access. We have organizations that have helplines. Yes. Queer organizations that have mental health care desk where you could literally call if you're in a crisis and get response. We have abortion services. So these are like baby steps, but they are commendable because also we're working within a very confined space where funding determines what can be done. Right? So yeah.
Also, I think I'll also say, apart from what is happening within the SRHR space or what technology is actually doing that's commendable. I would also say around economic empowerment, how organizations are beginning to channel utilizing technology to empower the community. For instance, I'm going outside of the community to look for someone who would design my website for me. But I can now do that with asking a community member or a lesbian woman who is trying to also progress in her career to design a website for me because they've been empowered, on having to, they've been trained on how to design a website or trained on how to actually even use the laptop or tech tools that can like bring up their careers in the path that, that kind of growth. So I see that happening within organizations, and it's very commendable.
Oh, yeah.
I also see that people are beginning to think around telehealth with organizations, and it's something that is new. I will not lie, within the space, but it's something that's commendable to as well. So kudos to all of LGBT organizations in Nigeria.
Yes,
I know they're doing so much work.
Yeah,
they're doing so much work, and it's highly commendable.
Thank
Keep
you.
up the good work.
So, one last question.
Okay.
Professors.
No.
So, when looking at tech-enabled SRH solutions, right, for the community, targeted at community members, right, how do we bridge the gap between those who have or who do not have access to these technological advancements and solutions? I'm talking the average queer person in rural areas. How do you think, as a community or as organizations, can we bridge the gap between, like, not just helping people in urban areas who have phones, who can reach someone? How are we getting to the grassroots?
So I would say it hasn't started, but it's something I'll recommend. It's something that I'll say, let's organize tech hubs in rural areas.
Yeah.
Have a center where young persons can come access those spaces.
Yeah.
And learn technology. Have like web-based solutions in those spaces. Because if we can't start saying you want to start sharing phones to rural areas. You can't, I will not say it's unrealistic, but in the sense of the work that we do.
It is unrealistic.
It's unrealistic. So I'm saying have so kind of those tech hubs where people can come in. It's a safe space and they can learn.
Yeah.
That's something I would definitely recommend.
Yeah, I think my recommendation is still within the same line, because at the end of the day, I started by saying that a lot of the SRHR interventions that we really need they lie in information.
Yeah.
If I have information, if a woman in any rural area has information, first of all, that, they have rights. They have a body that has rights. Nobody is supposed to tell them when to give birth, how to get pregnant, or to give birth to 20 children. Nobody can force them. When they have this information, they can be able to, first of all, self-advocate.
Yes.
So it boils down to information. If we are having tech hubs or even stands, even just tech drives, where we go to rural communities for a few days and have hubs where people can walk in and ask questions. There was this initiative I saw one time that I really liked. It's not an organization, but a queer initiative from a Nigerian. And what they do is they use football to go to communities. It's as easy as getting women and in rural communities and their daughters to pair up and play football and use that to talk about what
their bodies are
like, what even things as basic as the names of your private parts, what your period looks like, period conversations. They are part of SRHR.
Yes,
very, very important part, right? So there are things as basic as this information. If someone does not have access to tech, it doesn't mean they shouldn't have access to that information that you have, right? It's as easy as even peer education, right? A lot of the times it seems very overflowed, but we can never do away with peer education, especially because we have young generation of people who learn a lot from what their peers are talking about, even if they don't have phones. Conversations. A lot of us as teenagers, most of the things we were curious about was because our friends sat down and they are talking about it. They're talking about sex. They're talking about pleasure. Having affirming peer educators who can actually go out there and do the work that tech cannot do.
Yes.
And have the access that tech cannot have. It goes a long way in changing minds, changing how people view their bodies, how they view their needs and self-advocates. Yeah.
Thank you so much. This has been so... I feel like I keep saying this, but like it's true. It really has been educating and enlightening, to say the least. Thank you so much for your time. We have very sadly come to the end of this session. It's so sad to see you go.
It's fine.
But we hope we can do this again sometime.
Yeah.
I mean, it's a much broader conversation than what we've just had here. And then we need to keep having conversations like this. And that's what this space is for. So thank you.
Thank you.
Thank you for having
Thanks
us.
for having us.
I had nothing to tell you. You did all the teaching. So thank you. You
Thank
did
you so
majority
much.
of the work. Yes. Thank you for the work that you also do. This should not go without saying that. So thank you for your time. And we hope to see you again some other time. Again, please like, share, subscribe, and please, Biko, fast say comment. Tell me something you just learned today. I will comment too. I'll say what I learned. Also share. Thank you. See you some other time. Bye.